Thank you very much for having me. Thank you to Hunter's Hope for letting me present again. I'm not the newest member of the LCN, not an infant like Dr. Benko may have stated, but more of a toddler of the group. Um, so can we go to next slide, please? So I run the Leukodystrophy Center at Weill Cornell Medicine, which is part of New York Presbyterian Hospital, and we run our transplant in partnership with MSKCC. So this slide is just to give you a bit of a conceptual overview. We have the clinic where we see all of our patients in a multidisciplinary fashion, um, which at first touch point includes neurology, same day, endocrinology if needed. We have genetic counseling, and we can often get our scans done the same day as well. And we try to tailor that to patient preference. In the event that we can't diagnose patients clinically, we have an advanced diagnostics pathway, which I'll talk a little bit about later. And then in terms of therapeutics, again, we do our transplants in partnership with MSKCC, and then I'll review some of the clinical trials for gene therapy that we have happening at our center. Okay, next slide, please. So this is our team. It's on our website, which we list at the end of the presentation. But just to review, both myself and Dr. Palaganis, we are the two neurologists that see the most patients. Our clinic, at the moment, we currently follow about 100 cases, half of which are ALD. It's split 75-25 peds to adults. If you kind of look across, you'll see Dr. Boland's, who is the chief of the transplant service at MSK, who partners with us again to do our hematopoietic stem cell transplants for our patients. We have joint appointments, so I'm also appointed at MSK, and all the MSK faculty are appointed at Cornell, which allows us a lot of flexibility to take care of our patients. Yasmin Kaku is the head of child neurology at MSKCC. Shanila Lakhani is the director for the Center for Genetic Counseling at the Center for Neurogenetics, and sees our patients with us. Mary Montgomery is our neurodietitian for patients with epilepsy who are on a ketogenic diet, and then we can do various metabolic exclusion diets if the parents are interested. And on the bottom row, we have Dr. Cancio as one of our transplanters, Dr. Heyer, who's the head of neuroradiology, and I'm going to talk about some of the imaging work that we do at Cornell to try to make the experience better for patients. Dara Jones is our pediatric rehabilitation specialist, who has a joint appointment between Cornell and the Hospital for Special Surgery in orthopedics, and she sees all of our patients for their rehab needs and equipment. And then Dr. Skardal, who is also one of our transplanters. Helena, I have to update this. Helena Yan was our research coordinator. She has since moved on to medical school, and Kerry Gao has been working with me for over a year now, as our new leukodystrophy research coordinator. We are looking to continue to hire a care coordinator. As you can imagine, it's been quite difficult in New York City during the pandemic, but we are getting close. All right, next slide, please. So just to talk about the clinical program, just in terms of diagnostics, we see both new or new confirmed cases of leukodystrophy or undiagnosed cases, and we can go down the next gen sequencing and metabolic pathways to figure out or try to diagnose patients with a leukodystrophy. We do confirmatory testing from newborn screening. Again, we have genetic counseling, and we can do in-person and video visits, which was a rapid uptake, especially in the tri-state area during COVID. I see pediatrics and adults, like I said, 75-25. I say adults with caveats because there are some idiosyncratic limitations to insurance and things like that, which we are overcoming. From a research perspective, oftentimes patients with a leukodystrophy will go undiagnosed despite our best clinical efforts. So the other hat that I wear is in the Center for Neurogenetics, where we do whole genome sequencing. We do our own variant analysis on next-gen sequencing, whatever clinical testing patients may have. We can do functional analysis in the lab if we have people interested at Cornell working on a disease, but it also allows us to collaborate with the other leukodystrophy centers of excellence who are on this call. Importantly, though, I'd like to point out that this is a nice avenue for patient and family-driven research and investigator collaboration. What that really means is oftentimes we take care of families who have a new leukodystrophy or an undiagnosed leukodystrophy that we were able to diagnose through our research center, and they are interested in starting basic science research projects to forward the science for their specific disease. So what we do in this clinic is we take genetic history, do their whole genome sequencing, and I'll be the one who does skin biopsies and harvests their cells to do functional studies like Dr. Fatimi had mentioned, where we can take the patient's fibroblasts, turn them into stem cells and then neurons, and then try to study to get to the bottom of what is happening with the disease at a molecular level. And oftentimes this piece is driven forward by interested families and patient foundations, and has led to international collaborations for multiple neurogenetic diseases. Next slide, please. So this is just the website for the Center for Neurogenetics, which again is the other hat that I wear and we utilize for our Leukodystrophy Care Center to help diagnose undiagnosed cases and then collaborate with known leukodystrophy cases. Next slide, please. So in terms of disease surveillance, our clinic provides routine neurological and pediatric subspecialty care. The team that I showed you on the first slide is sort of the main group, but the services at Weill, Cornell, New York Presbyterian, we have all pediatric subspecialties where patients can be plugged in a timely fashion to be seen. We do specialize in neuroimaging surveillance. One of my research interests is in brain development and looking how myelin changes over time. We do provide for the ALD cases real-time reading for patients who are undergoing MRI surveillance for conversion to cerebral disease. So while the patient's in the scanner, we'll read the scan in real time, and if we don't see a lesion, we'll pull them out and not have to give contrast agents. And we also developed what's called the MRI I Am a Hero program, where patients work with child life specialists while in the MRIs to get them to perform unsedated MRIs at a younger age. We provide movie goggles. And the earliest patient to date that we actually scanned with ALD, with asymptomatic ALD without any sedation was at 5 years old. So that's the youngest we've gotten so far. I'm trying to push the needle backwards a little bit more to maybe get into the 4-year-old range. Usually patients require sedation for their MRI scans up until about the age of 7 or 8. But with the help of our child life group and the movie goggles and a little bit of music, we've been relatively successful. Next slide, please. So on the left is an MRI scan of a patient, I have permission to use this, of a patient in coronal section, and you'll actually notice the actual goggles on the patient himself. So that's what it looks like in the MRI scanner, nose and mouth. And then just a, this is a part of the article about our MRI I Am a Hero program, where we, again, try to scan patients without having to expose them to anesthesia. Next, please. And then in terms of clinical therapy, we really function mainly at New York Presbyterian, Weill, Cornell to provide all the multidisciplinary care services needed. And in the event patients need to go to transplant, we work with the folks literally across York Avenue. I can see MSK from my office to do the transplant. Our program is, again, young. We haven't been around for much longer than some of the newer centers, but in this past year, despite COVID and the challenges in New York City, we've transplanted 2 patients, one patient with cerebral ALD, identified on newborn screening, and a 3-year-old patient with Krabbe disease. Next slide, please. And then in terms of clinical trials, in New York City, there are a lot of hospitals with a lot of expertise. I think ours is particularly well equipped to handle gene therapy trials. So we're just finishing up a gene therapy trial for NPS 3A, which started a couple of years ago, and then in IRB, but we are site selected to go forward and participate in the Krabbe disease gene therapy trial with Passage Bio, and then a phase 1 trial for adrenal myeloneuropathy for some of the adults that I see. Viking Therapeutics, which will hopefully turn into a therapeutic interventional trial down the line. And this is with an aim to expand more clinical trials into leukodystrophies in the coming years. Next slide, please. So this is our contact information. You can call us anytime, 212-746-3278. We have an email as well, and then you can also just search us on our website. Rebecca is our administrative specialist, but our office is small and our program is tight-knit, so you can speak with anybody, and I promise you they will be able to find me. Thank you.